Good morning, Bill. Thanks for coming in this morning.
Thanks for seeing me.
Okay, now just before we get started, can I just confirm a few details that we
sure.
have on file for you? Okay, so your date of birth is the 26th of March 1934,
That's it.
and you're still living at 4 King Street, Spring Hill?
Spring Hill, yep.
Okay, great. Now I can see that you brought someone along with you today.
Yeah, this is my friend David.
Hi, David.
David's a great friend and has been great support since my wife died. My kids have moved away, so he helps me with a lot of chores and going to shops and things like that.
Okay, awesome. Now, what brings you here today? What can I help you with?
I'm not sure if you can help. I'm an old man, never done much exercise.
Okay.
Also, you can
That's
see
okay.
from the reports that I brought along prostate cancer.
Yep.
It was diagnosed quite late, and I'm actually doing pretty well at the moment, apart from a rough period during my treatment.
Okay.
I just want to live as long as I can and as well as I can. It's important to me to be independent, and my doctor thinks that exercise can help with this, but I don't know where to start.
Okay, well, just straight off the bat, that's just a really positive attitude that you have, and that makes all the difference. I can see you've been through a lot when I look at the medical reports here, but I'm sure we can work together to help you achieve your goals. I can see you were diagnosed 10 months ago with an adenocarcinoma. It was picked up at quite an advanced stage, so and I see you have some bone metastases as well. Has your doctor spoken with you about that and your prognosis?
Yeah, he's explained that about 30% of patients like me live for another 5 years. I'm okay with that.
Okay, all right.
I've had a great life, so.
Mm-hmm. Okay. Now, you mentioned, and I can see like a rough period with your treatment. Now, I'm going to assume that you're referring to the chemotherapy here, because I can see from the reports that you completed 3 of the 6 scheduled cycles, and you needed to be hospitalised due to side effects during that time as well.
Yeah, that's right. They put me on a lower level than they wanted to because I had low hemoglobin levels.
Sure.
I immediately had issues with my bowels, some bleeding, some diarrhoea.
Okay.
They gave me an iron transfusion, and I have to go in for a colonoscopy down the track.
Okay.
There was a delay in my treatment due to my low hemoglobin, a fever and some breathing problems.
Mm-hmm.
Finally, I ended up in hospital again with a fever and infection as well as diverticulitis.
Okay.
I'd had enough by then, so I was pleased when they stopped it.
Okay. Well, where we're sitting here today, I'm genuinely really sorry that you had to go through that. Now, the low hemoglobin count is quite a common side effect of chemo, unfortunately. And I can see you're on medications for that now, but it really sounds like your body didn't tolerate the chemo very well at all. But on the positive side, it looks like the hormone therapy has been going much better.
Yeah, immediately positive results, so I don't seem to have any side effects from it.
Okay, so no hot flashes, no weight gain.
No, actually I've had trouble keeping on the weight since this all began. I've lost quite a lot.
Okay, we'll explore that. But how about around the injection side? Any irritations with the skin at all?
Maybe a little itchy or achy after the injection, but nothing really bothers me.
Okay, good. Now, I can see from your latest results that your PSA levels continue to drop. So there's a decreased nodal disease, so the disease in your lymph nodes, okay, and the bony lesions. So that's all great, okay? Now, we do still need to be careful with your bone metastases, okay?
Yeah.
Now, just to reassure you, we're going to be careful to avoid impact through your pelvis, okay?
Yeah.
But as we go through it, you must let me know, okay, if you experience any pain in that area or anywhere else for that matter.
Great, I'm just happy not to feel sick all the time. I've been lucky not to get any side effects from the hormone treatment. As soon as I stopped the chemo, I started feeling better, so I can go about my day reasonably well.
Okay, well, do you know what? I think that's great, and I think this is really the right time. This is a great time for us to be working together. Let's just touch on the rest of your medical history. It's really important to get a holistic view, and I just want to thank you for providing that information. It's really helpful. Now, firstly, I can see you had some heart bypass surgery in 2005. How did that go? Any complications following that?
A bit scary at first, but it seemed to go okay. I haven't really thought about it much since then.
Okay, good. Now, I can see that your blood pressure today was actually a little low despite those medications. Do you ever have feelings of dizziness, nausea, blurred vision, anything like that?
No, it all seems to be okay. No side effects from any of those medications.
Okay, well that's a great sign. We will keep that in mind while we're going through your exercise program, and we'll be sure to take your blood pressure before we exercise, during and then after as well. But looking at your recent blood results, it seems that your other areas, your medications you're taking for your diabetes, they seem to have it under control. Despite that, I'd still encourage you to chat with a dietitian about your weight loss. Okay, they can help you with nutrition that will help you boost your energy levels and essentially your ability to do day-to-day tasks.
Well, I think that's a good idea, thanks. I can't remember last time I was this weight, so my clothes are falling off me, and I think it's contributing to me feeling a bit weak.
Okay, for sure. Now, again, your cholesterol and triglycerides, a little outside of what we'd like, but overall I think it's looking pretty okay. Now, we will keep an eye on it though. Your blood sugars are also probably a little bit high, but going back to the dietitian, I really think that that's something that they can help you with as well.
Yeah, not a great surprise. My appetite's not what it used to be, and I know I'm not eating that well.
Okay. Now, I guess you need to be aware that the cancer and the hormone treatment that you're having for that is also going to be impacting those feelings of weakness and fatigue that you mentioned. It's just not the diet. And I can also see that you've had anemia for some time now, and that's also going to be contributing to the feelings of fatigue. In regard to that, do you ever experience any heart palpitations?
No, not at all.
Okay, good. Well, that's really good, but we will still consider that when we're designing your exercise program, okay? And I'll probably get you to do most of your program under supervision, just to keep a track on all of this at least to start with, and I'll make sure that you get plenty of rest between the sessions and also within the sessions whenever you feel the need.
Okay, that sounds like a good idea. I'm not used to exercise.
Okay, all right, well, you'll be pleased to know that there's been a lot of research regarding the benefits of exercise with patients just like yourself, and the results have been really positive. So, you talked about being able to be as independent for as long as you can, and I can tell you that everything points towards exercising, helping you increase your lower body strength, okay, which is going to help you with your walking and your fatigue in that sense, reduce feelings of fatigue overall. And as this happens, you should feel that your overall quality of life essentially improves as you maintain your ability to do the things that you've always been used to be able to doing.
That all sounds good. I'm worried the exercise will cause me a little bit of pain.
Okay, I totally get that, and I understand that you're on Panamax, which I assume is for the periodic bone pain you feel through the pelvis. But I can assure you that exercise doesn't seem at all to increase any pain in those bones. And any time that you want to stop, rest, do something different, we will.
Okay, great.
Okay, so we'll continue with exercise right through the palliative stages for you for as long as you're able to tolerate and for as long as you're able to receive the benefits from it.
Good, I just want to be able to function as normal as long as I can.
Okay, well, I can assure you that we can certainly work towards that.
Great. I feel like I've got a bit of control back, and that's pretty important to me.
Okay, so awesome. Let's work as a team. How does that sound?
Sounds great.
All right. Okay, well, I'm really pleased to have met you here today, Bill. Why don't we set aside a time for you to come in next week and we can just do some exercise testing to see what your functional capacity is, and then we can work out some programming. And you're really welcome to bring David along with you.
Thanks.
As long as you want. That's no problem at all.
Brilliant. Thanks for seeing me.
Okay, no problem. Thank you.